که وقت یک شنبهتون رو گذاشتید و اومدید اینجا حضور پیدا کردید، خیلی ممنونیم. من الان از ماه می شدم برای این 2 سال پرزیدنت. دکتر معتمد هستند وایس پرزیدنت، دکتر اسکندری هستند سکرتری انجمن و داریم دکتر نجفی به عنوان پس پرزیدنت که این و دکتر شمعی به عنوان ترژر که الان اگزیکتیو کمیتی سیپنا رو تشکیل میدیم. یکی از برنامه هایی که گذاشتیم اینه که حداقل تا میتینگ سال آینده حداقل ما بتونیم 5 برنامه ادویکیشنال 2 ماه یک بار داشته باشیم. این اولیشه برای امسال که شروع میکنیم. برنامه بعدیمون در ماه سپتامبر خواهد بود در مورد ادیکشن با دکتر روین فریان و دکتر حامد اختیاری که در مورد ادیکشن و TMS در ادیکشن که ریسرچشون رو صحبت میکنن. در ماه نوامبر ما یک فیلم ایرانی جاده خاکی هیت رود مال پناهی رو میبینیم که خانم دکتر علوی مادریت میکنن psychodynamic discussions over that movie و اینا 3 برنامه‌ای که تاریخاشون رو میدونیم و برنامه بعدی رو بعداً به اطلاع خواهیم رسوند. همینطور امروز ممکنه بعد از این یک صحبتی از خانم دکتر حمیدی بخوایم که برای ما صحبتی کنن که برای که سیپنا میخواد فعالتر امسال در راهپیمایی که برای سویساید پریونشن میشه ما میخوایم فعالتر باشیم، به نام سیپنا باشیم و اینا هم همه آیدیاییه که از جوانها میاد. یعنی به طور کلی ما بگیم که چیزی که همه ما میخوایم این که سیپنا یک استپستونی باشه، یک پایه‌ای باشه برای جوانهای ما که بیان اینجا پلتفرم رو استفاده کنن، برای خودشون پروفایل خودشون رو استفاده کنن و خوشحال میشیم اگر کمکی باشیم به جایی برسن و در این حال ما از معلومات اونها، از دانش اونها، از لیدرشپ اونها در واقع ما استفاده میکنیم.
نه همه جا
در مورد این چیزا بعداً بیشتر صحبت خواهیم کرد و در همه ما، من، دکتر معتمد، دکتر اسکندری، دکتر شمی، دکتر نجفی، we all are open to هر ایدیایی، هر نظری، هر کریتیکی که دارید feel free to tell us و ما همه گوش شنوا خواهیم شنید و سعی میکنیم که اونو انجام بدیم یا اگر اشکالی باشه رفع کنیم. So let's forget. یکی از جوانهایی که ما گفتیم که دوست داریم که بیان و در این سیپنا کمک کنن خانم فاطمه میرهاشمی هستن که امروز همه باش خیلی بیشتر آشنا خواهید شد. خانم فاطمه میرهاشمی الان اینترن سیپنا هستن، کارهای خیلی برای ما کمک میکنن، بخصوص با دکتر اسکندری در کارهای ادمنستریشن خیلی فعال هستن و اگر همین اشکال ایمیلی چیزی دارید به ایشون بگید، ایشون فوراً رفع خواهند کرد، برای اینکه خیلی خوبن در این کارشون. و همینطور این صحبت و transgenerational trauma was a mutual interest between me and her, and actually this is her research, her focus of the research. So we said, okay, let's start and talk today. This پرزنتیشن بیشتر خانم میرهاشمی خواهد بود و منم به چند جایی ممکنه چند صحبتی در موردش خواهم کرد و بعداً we are open for question for Q&A. So about Miss فاطمه میرهاشمی. خانم فاطمه میرهاشمی تو ایران به دنیا آمدن و از 9 سالگی به کانادا آمدن و در کانادا بزرگ شدن. تحصیلاتشون در کانادا بوده. She just graduated from McMaster University with an honors bachelor's of applied science in applied psychology and a minor in mental health, addiction, and society. Her research focuses on trauma, resilience, and global mental health, with a particular interest in how trauma is transmitted across generations, which is the main topic that today we want to discuss and talk about. currently الان ایشون یه ریسرچ اسیستنت هستن در همون مکمستر یونیورسیتی and serves as an intern with our society SIPNA. Fatemeh's plans is to pursue a PhD in clinical psychology with the goal of advancing culturally responsive mental health research and improving access to care for immigrant and refugee communities. So, خانم میرهاشمی,
بله
please start.
سلام بر همه خیلی خوشحالم که الان کنارتون هستم. Thank you all for being here. I first learned about SIPNA a couple of months ago, and I love the idea of an entire society of Iranian mental health professionals. I learned about them during the beginning of January while many Iranians were experiencing mental health issues and struggles because of what was happening in our country and in the diaspora. And I wanted to do something to help Iranians in the diaspora and help their mental health. And my focus in research has always been transgenerational trauma because I think it's actually a very important topic within minority immigrant communities like ours. So I'm really excited to be here today, talk to you guys about it. And yeah, thank you for having me.
Okay.
So when we talk about transgenerational trauma, the first thing I want you guys to think about is what do we inherit? When we think about what we inherit across generation from our families, we think about how we inherit our DNA, our traits, our culture, and our traditions. You may recognize that you have your mother's smile, your father's eyes, or your grandfather's intelligence. And whether we realize it or not, part of the legacy we inherit is actually the lasting effects of the trauma experienced by the generations before us. Now, this is a very emerging area of research in psychology, as we've been exploring and investigating the idea of how the effects of trauma can be inherited, so that parents who have experienced trauma can unintentionally pass these burdens onto their children, affecting second and even third generations who may or may not have directly experienced trauma themselves. And yeah, to better understand trauma transmission, let's take a look at what trauma is and how it's understood. Over to Dr. Gelyana.
Okay, here we want to talk about stress and stressor that you all know, but we just want to make sure that we all on the same page. In physics, stress, usually when we talk about the stress, we talk about the force. But in psychology, when we talk about the stress, we talked about the events, conditions, and circumstances around us. So the force in physics causes a change in a matter. Stress, it causes a change in our functioning. So whatever the condition, whatever event or circumstance of life at any phase that causes some symptoms in change of air in our functioning, impairs them, then we call it, that's a stress. Source of stress can be internal or external. Feeling hungry, feeling thirsty can be a stress. Also losing a loved one, being in a natural disaster can be a stress. Stressors, again, are when something causes stress, usually it causes changes in our adaptation, our behavior. And when we all have a routine that how to deal with problems, but when stressful happens, usually it's something new. It needs some new coping skills. It's some new ways to handle that event. It's a non-routine one. So that's when we say we are dealing with stressor. Stressor can be positive, like we get a promotion at work and we don't know how to handle it, or a negative, suddenly our house goes to fire. It can be a single event. Unfortunately, somebody gets raped is a single event, or a car accident, bad car accident, or can be multiple stressors. A person is in a war zone. Every day there is something change happens. Can be recurrent or continuous, like unfortunately many childhood maltreatments that goes in abusive environments. Some can affect a single individual, is a car accident, or you lose someone, or your partner cheats on you, or entire family. Something happened in a family, in a household, or a larger group or community, a natural disaster, a war zone, or something like that. And it may, sometimes some phases of life, going to starting high school, starting college, can be stress, maybe sometimes needs some adjustment, becoming a parent, or getting married, all those changes, or becoming a widow, they all can be a stressor in life. And when the we, Okay, and when we talk about trauma, trauma means that in Greek means injury. So any injury, any wound is called trauma. But in psychology, when we call trauma, means when a person is overwhelmed, with capacity to accept that event or respond to it. The trauma can be acute, chronic, or complex. When it's very acute trauma, usually the risk of PTSD is higher, acute PTSD. And when there is repeated or prolonged, usually that's when we see complex PTSD. And something that always we should know, just like anything else, just like any other mental illness, not everyone that goes to a war zone, not everyone that being in a natural disaster, not everyone that get raped or loses someone will develop symptoms of a trauma disorder. So there are multiple factors. So there are bio, psycho, social, spiritual factors that can cause a person to develop those responses. So the same comes with responses to trauma and trauma-related disorders. Not everybody that goes through the single trauma will have the same outcome.
So Dr. Gillian touched on this a little bit, but I'll go into a bit more detail. Essentially, we no longer view stress and trauma as separate entities and separate experiences. Researchers have begun to understand them as existing along a spectrum. Chronic stressors, like experiencing poverty or discrimination, are common across so many populations, and sometimes they can turn into trauma over time. Chances are that nearly everyone here has also experienced chronic stress at some point or another. For example, a lot of us here in this room are immigrants right now. That itself, the process of immigration, can be a chronic stressor. It is also estimated that more than 70% of people worldwide will experience at least one traumatic event in their lifetime. And these rates are even higher in refugees, survivors of violence, and individuals living in conflict-affected regions. Individuals who experience both chronic stressors and trauma are at greater risk of poor mental health outcomes, reduced well-being, and functional impairment, as their cumulative effects create greater distress for them. Now, when we discuss the effects of stress and trauma, we usually understand them in terms of how they affect the individual. However, in recent decades and in recent research, psychologists have begun exploring the theory of generational trauma, which states that the effects of trauma can extend beyond direct exposure and transmit from parent to child and impact future generations who may have never experienced the original traumatic event themselves. So to better create this, like a visual demonstration of this concept, we're going to go through a little example. I want you guys to imagine a mother who's experienced the trauma of living in a war zone, but later immigrated to a different country. Even though she's no longer actively living in a war zone, the psychological and even the physiological effects of her trauma will likely last for years. She might experience PTSD, depression, anxiety, difficulties regulating her emotions, and difficulty in her relationships. Now, let's later say that she has a child in her new country. Even though the child hasn't experienced the war directly, the mom's traumatic experiences may continue to influence the child's development. The mother's trauma will affect how she responds to stress, how she interacts with the child, and the way she models emotions and coping strategies. As you kind of can see in the visual, it hangs like a cloud over a child's head and affects their development. And researchers have also begun identifying biological pathways and epigenetic mechanisms that contribute to the passing of this trauma. So, according to this theory of transgenerational trauma, then, even though this child never experienced the war firsthand, they're still more vulnerable to psychological, biological, and interpersonal challenges because they carry the effects of their parents' traumatic experiences. And if those trauma-related effects continue from one generation to the next, there's potential for the cycle of trauma to continue across multiple generations, affecting the child's child, essentially, and so on and so forth. So now we can kind of go into the origins of this research. How did it come to be? How did we come to understand what this theory is and how it develops? Some of the earliest research on this topic actually was from a Canadian researcher, a Canadian psychiatrist, Dr. Vivian Rakoff. In a 1966 paper, Dr. Rakoff described three children of Holocaust survivors who had been referred for psychiatric treatment, and despite never directly experiencing the Holocaust themselves, they experienced significant behavioral concerns and showed psychiatric symptoms. Now, this paper was actually the spark of decades of research on this topic, investigating the effects of transgenerational trauma, specifically and predominantly in the children of Holocaust survivors. They're actually one of the most extensively studied populations in this research to this day. Now, over time, researchers expanded this work to include other populations, predominantly Indigenous communities affected by colonization and residential schools, descendants of enslaved African Americans, refugee families, and survivors of war and genocide. But it still predominantly remains focused on Holocaust survivors. It's still an emerging field of research. So, after Rakoff's observations in 1966, researchers spent decades investigating whether children of Holocaust survivors were more vulnerable to psychological, behavioral, or interpersonal difficulties than their peers. And although the earliest studies were limited by very small sample sizes and a lot of methodological difficulties, a lot of them reported findings that reflected Rakoff's original observations. So, in their review of early literature, it's described that a broad range of difficulties exist among the children of Holocaust survivors, and that includes anxiety, traumatic nightmares, hypervigilance, interpersonal difficulties, impaired self-esteem, and worries that their parents' traumatic experiences would somehow be repeated in their lives. Similarly, children of Holocaust survivors frequently experience anxiety, depression, and difficulties in their relationships. And most importantly, recent research has extended these findings by comparing the children and grandchildren of Holocaust survivors with descendants of Jewish families who lived abroad during the Second World War. And they found that descendants of Holocaust survivors were far more likely to exhibit symptoms of PTSD. And they actually found that this effect was far stronger when the mother was the sole survivor. So, extending this research beyond Holocaust survivor families, studies of Indigenous communities have also reported transgenerational effects of trauma, linking experiences such as the residential school system to increased substance use, suicidality, and disruptions in family cohesions, even among younger generations who never experienced residential schools themselves. Research among African American families has also shown that the legacies of slavery, segregation, and honestly, the ongoing structural racism that this population faces are associated with increased vulnerability to anxiety and depression in youth. These patterns have also been observed among refugees, as reviews of this literature found associations between parental PTSD and increased PTSD vulnerability in children of refugee families in the US, refugees from Cambodia, Sudan, and Vietnam specifically. There's actually not a lot of research on this topic for Middle Eastern populations. There's even less research in Iranian populations, which is what we're hoping to remedy at some point. Um, yeah, and similarly, mothers of children who survived the Cambodian genocide, essentially their children have been found to be more vulnerable to post-traumatic stress symptoms, despite being born after the conflict. And this effect was actually found to be more stronger in daughters. So these are just a few examples of the extensive literature on this topic. But the pattern you can kind of observe across all these types of diverse populations is that essentially the children are more vulnerable to a lot of more mental health difficulties. But we should say that this is still an evolving area of research, and a lot of the studies on this topic are limited by very small sample sizes, cross-sectional designs, a lack of longitudinal research, and a few other methodological difficulties that make it difficult to draw causal conclusions or, yeah, any of that, especially when it comes to how it's transferred epigenetically. It's also worth noting that research on third generation trauma is still in its early stages. The theory essentially says that the trauma passes from mother to child and from child to grandchild. But at this point, the research is very limited on whether you actually do see the effects in the grandchildren. And basically, it's not very consistent as of now. Some studies say that you can, others say that they haven't found strong conclusions. So it is an area worth exploring in future research. And now that we kind of understand what transgenerational trauma is and what the evidence supporting it is, we can kind of turn to the question of how it's transmitted. So there are three primary mechanisms of transmission that are found across the literature. The first is parenting and attachment. Second is modeling the effects of trauma. And third is biological epigenetic pathways, specifically epigenetic mechanisms, yes. It's essential to emphasize that these three mechanisms are not independent of one another. Essentially, they feed into each other. So, for example, if a child develops anxiety or depression, it's often impossible to determine how much of it reflects an inherited biological or epigenetic vulnerability and how much of it stems from growing up with a parent whose trauma has shaped their parenting, attachment, and response to stress. And as with many other mental health difficulties and theories on psychiatric conditions, the more likely explanation is that the mechanisms interact. The biological mechanisms, the epigenetics, the transmission through DNA that interact with the environmental stressors and being a child under the roof of a parent who has experienced trauma. So the first and most studied mechanism when it comes to the transmission of trauma is the parent-child relationship. It's the most consistently supported mechanism, and it is considered the primary pathway for transmission. And the reason for this is that trauma inherently interferes with a parent's emotional availability, and as a result, it can influence their parenting practices. Parents who experience trauma usually have more difficulty responding consistently to their children's emotional needs as a result. And studies have found that trauma-exposed parents are more likely to demonstrate emotional disengagement, hypervigilance, less emotional availability, and harsher parenting practices. And this kind of leads their children to be more likely to experience behavioral and emotional difficulties, as we've seen in the evidence in the literature. Research also suggests that parents who experienced abuse or victimization during very critical periods in their own development in childhood are at greater risks of continuing the cycles of abuse and victimization with their own kids. And trauma-exposed parents also unintentionally transmit maladaptive schemas of disconnection and rejection to their children. So a lot of the trauma effects that we see are essentially attributed to be the mechanism of parenting. And many of these patterns, as we said, were first observed in Holocaust survivor families who showed parenting styles characterized by overprotectiveness, fearfulness, emotional numbness, dysfunctional communication, high expectations with a lot of high criticism, and a lot of cases, parentification, which is when children kind of have to take on a caregiving role for their family, becoming the parent, a third parent. It's most common with eldest daughters. And over time, growing up in this kind of environment can impact the child's attachment and emotional development. Studies have linked these family environments to insecure attachment, poor family functioning, dysfunctional communication, and a heightened sense of responsibility in the kids, as a lot of them report that they feel responsible for protecting their parents' emotions, or solving their family's problems and carrying the emotional burden of the family. As we talked about, it is the burdens we inherit. And of course, these effects don't look the same in every family, and the extent of this trauma transmission depends on the severity of the parent's trauma response and whether both parents have experienced trauma as opposed to one. Parents' gender is also very important as maternal trauma actually has stronger associations with children's outcomes. So, a mother who has experienced trauma is more likely to transmit this to her child. And the second proposed mechanism is modeling the effects of trauma. Beyond a direct relationship between parent and child, children are constantly observing how their parents respond to the world around them. And parents who continue to experience symptoms of trauma can unintentionally model these responses to their kids. Over time, kids will adopt similar ways of interpreting and responding to stress, even if they haven't experienced the original traumatic event. Family communication is also incredibly important, as studies have shown that when parents avoid talking about their traumatic experiences, children also learn to avoid these topics because they don't really want to upset their parents, they're fearful of that. And as we've previously said, they feel like they need to protect their parents and their emotions. But at the same time, avoiding these topics and this type of silence leaves children to imagine what's happened to their parent. And they create these trauma narratives to fill in the gaps, which essentially may create more distress for them. On the other hand, sometimes parents share too many traumatic details too frequently and in detail that's not developmentally appropriate for the child. And that's also been associated with negative outcomes. So essentially, too little and too much communication about trauma can both lead to this transmission across generations. It's important to note that this is not intentional. Parents don't intentionally try to, I guess, carry on these burdens to their children. Just a trauma-affected person is inherently more likely to display these behaviors. And we can think of it in terms of the quote that you only give what you have. And a trauma-affected person only has so many resources. And sometimes that leads them to not be able to be as emotionally available or responsive for their child. And it's also important to note that modeling isn't limited to trauma. Children can learn fear avoidance and emotional dysregulation, but they can just as easily learn healthy coping strategies. They can learn emotion regulation, and more importantly, they can learn resilience. This is also one of the reasons why positive parent-child relationships and open family communication are very important protective factors against transmission of trauma.
So another thing that we want to discuss it very briefly is about epigenetics. Nowadays, we believe, as we said, everything biopsychosocial, that this trauma also can be transferred through generation by biologically, and whatever the theory that nowadays have is epigenetics. So what epigenetics is in and you all know it, but just we want to just summarize it. We know that DNA has codes for proteins that it makes. This DNA, these codes, let's call it nucleic acids. The rows of them are covered by a protein. We call it chromatin, and we know that there are by methylation around these chromatin, they can make it very tight, so some of these genes cannot express themselves. So, for example, they inhibit it. in general, whatever we can call it, that, for example, you have something in a valuable, in a very, and make it around it a very hard surrounding around it, and you cannot reach that valuable thing that is inside. So this is what epigenetics says. Epigenetics says that mostly methylation and this histone, which is the main thing, the chromatin around the DNA that covers it, these can be manipulated, and mostly at the sites that there are cytosine and guanine, that's the main part that are methylated, the methylation affects. So this has some bad news, that when this happens by trauma, they say increase all the environmental factors. The environmental factors can be some like some pollutants in the environment. Some can be the food that we eat, some be the stressors. They all affect this way of methylation. And this is the bad news is that when they methylate, so these can be inherited to others. But the good news is that the main code is intact. The way that is covered, the way the covering of it is manipulated. So maybe we have ways to come and in the modify the enzymes that they work on this methylation, and also the chromatin formation around these genes and DNA formation, so we can loosen them, and then the gene can express themselves. So this is whatever nowadays are working. And we know that one thing that works on epigenetics very well is working on exercise and food and supplements that we know that they directly can work on these epigenetics. So the main thing that we said, that when a person goes through a trauma, and the response happens, it affects that person's interaction with offsprings, and that you heard about it. And also we know that that trauma will affect the genes in an epigenetic form. So that also can be inherited to the offsprings. So offsprings will be a person that gene cannot themselves, and plus having all those emotional problems that they had with interaction with their parents. But the main issue is that now what we can do.
Yeah, the question now becomes, now that we know this effect exists, now that we know these cycles of trauma exists, can they be broken? How do we heal from them? What do we do? Now, to give you guys a visual demonstration of what generational trauma is, essentially we're going to use the example shown in this video. It kind of gives a very brief visual of what it can look like and what breaking cycles can look like. And as you'll see here, it just says it takes inner work. Yeah. So they are reversible, and now we'll learn how. So while trauma can be passed across generations, so can healing and resilience and healthy coping. And this is what the studies on this topic consistently emphasize that it's reversible, and prevention and early intervention are among one of the most effective ways to interrupt these cycles. One of the first priorities when it comes to understanding how we can heal from this trauma is helping parents process and resolve their own trauma and preventing these cycles from continuing further. Rather than trying to erase the trauma that the parent experiences, Interventions should instead focus on helping individuals recognize the process and integrate the traumatic experiences into conscious awareness so people can heal from them rather than avoid them, as a lot of people tend to do. So, creating psychological safety within the trauma-informed therapeutic relationship is an essential first step in this process. Researchers also talk about the importance of providing trauma-informed mental health services and recognizing the cultural and sociopolitical context that trauma occurs in. This is especially important when working with immigrant and refugee communities whose experiences are usually impacted by war, displacement, and both pre and post migration stressors. Strengthening the parent-child relationship is another key strategy. There's parenting programs, attachment-focused interventions, and family therapies that have been proven to improve emotional responsiveness, strengthen attachment, and support healthier family relationships. So we can essentially prevent the transmission of the parent's trauma to the child. Communication is also incredibly important. Earlier, we talked about how silence and overwhelming discussions on trauma can contribute to trauma transmission. And the research says that being open, honest, and having developmentally appropriate conversations about trauma and healing can actually help children understand their parents' experiences better. And it helps them process difficult emotions that they may have when it comes to survivor's guilt or feeling like they need to protect their families and protect their parents. It creates a shared understanding of the experiences, and it makes sure that children don't fall into this narrative of having to fill in the gaps of their parents' trauma themselves. And one of the most important takeaways from this research is that we shouldn't only focus on trauma. Strength-based approaches encourage us to recognize resilience, cultural strength, and families' capacities to heal. And just as trauma can pass on from generation to generation, so can resilience. Community history, cultural traditions, family connectedness, and stories of overcoming the adversity can become great sources of strength for future generations. If we think about it, this is also very relevant to the Iranian community and how we as a culture are known to be very resilient. We have the stories of the Shahnameh, we have the stories that help us, show that we are resilient as a country and as a culture. And here, Dr. Gelyana will talk a little bit more about why transgenerational matters to Iranians particularly.
Our country throughout the, let's call it, thousands of years has gone through so many massacres, so many problems that they all survived. But the pain is there. We all have it. And sometimes we do the best of it like in our literature, I think is so rich because we have gone through all these problems. And many times I think the best way that we were able to express our feelings was through the literature. Then nowadays, whatever we think, now that we know about this transgenerational trauma, maybe we all are somehow have some of it in us, in ours. And also something that we should know, in the last few years, so many things happened. The immigrations, from the politics on each side that you see, people were suffering, people were dying, all these, let's call it civil unrest and just this all has affected many of our people with any ethnicity, with any religion, with any political view. So it has affected all of those. So our job as people in mental health, in order to what we need to do for our people, is that it's good that we first know the symptoms, and the very beginning is that we make it easy for them to talk. If they are in diaspora, if they are inside, it's okay to talk with whatever feelings that they have. It's good that they start expressing their feelings. and and even if we have groups that they talk to each other. So I think this is things that we can come up with plans. It's not that simple. We should all come up with the plans to have like healthier and see how much we can prevent or heal the effects of this transgenerational trauma to the younger population that now we have in our community and their offsprings in the future. So this is something that we should know. And also we talked about epigenetics. So it's always is good that we talked about the moralities, about the let's call it diet, exercise, all the modifying factors of epigenetics alongside with the event and here and see how much we can go with this, how much we can work on forgiveness of each other and move on with life. So this is something that is good, is our message of this transgenerational, that although this is not a DSM entity yet, but there are researchers going through and about like let's call it in the last 50, 60 years they are working more and more in it. We don't have a study in our population, but thanks to Dr. Mirhashemi, she has started a small scale study in an immigrant population in Canada. So that's is a stepping stone, is a starting stone that we all will support her in this study, and hopefully we will go along with this.
Thank you so much, Dr. Gelyana. Now, next is our Q&A portion. So anybody who has questions, Dr. Alavi, I see your hand is up.
First of all, congratulations on what you did. Uh, you are young and you have a long way to go, and you are going to be a very good source of helping many people and families. What you talked about was the intergenerational transmission of trauma or feelings that goes from parents to the children and so on and so forth. And in fact, few generations. For that reason, um, I think this is what I have done with a group of people in Philadelphia. For over 30 years, we did a lot of workshops, seminars, movie interpretations, and Dr. Maani was one of our heroes to interpret a lot of Iranian movies about these issues. One thing that came out of those, which I recommend that you look at it, is that how and why those feelings in the parents come. What are those feelings that they're going to be transmitted to children? And for that, we had these meetings that we called it the psychological impacts of immigration on immigrants. And out of those many workshops, seminars, and movie, etc., a book came out it's called by Dr. Salman Akhtar. I don't know if any one of you know him or not. He's a very famous psychiatrist, psychoanalyst. Very, he's very famous all over the world and goes lectures everywhere. The book is called The Third Individuation. And what it means is when a child individuates from the parent at a very young age, that's the first individuation. The second individuation, when the teenager wants to individuate from the mother, that's the second individuation. And then the third individuation when we leave mother home. And that's when we are going to separate from our mother, and we still feel connected but far away. I still feel the same. I still feel Iran is my I separated from my mother. And in that book, it's also in Java is a paper that he wrote there. You can article, but the book is very interesting. Is that it explains that what goes through our mind and feelings as an immigrant. what are the issues that hurt us? What are the issues that feel us alienated or we are far away and we individuate from our motherland and we still long for it? And what are the impacts that the new society puts on us? And without we realizing, it affects our children. One of the issues is we would tell our children, oh, Gorme Sabzi is the best. You should take it to school. The child goes and smells come out, and the children are going to make fun of the child. And the child has to lie in a way that he may put the food in the trash can or don't eat it. But when he goes home, he has, oh, yeah, it was nice. So there's so much which the parents, without realizing that this child is in a completely different environment, and we just impose on the child to be like us. And to be honest with you, that's why I went into mental health. I was a professor in economics and um, management for 40 years. But I went into this field because I realized I'm missing something. I don't understand my children, and I have to learn how to deal with them. Maybe a little bit too late because they were teenagers, at least my older one. But it's a very important issue that we understand the origin of those feelings that parents have and the things they say in the house, that when their grandparents come from back home, they expect different things from our children. When they are born here, they go to school here 8 hours a day. The rest of the day, they're on TV here. And the child is torn between two cultures. And we had different populations, Iranians, Indians, Pakistanis, from all over the world. And I think what you have started is beautiful, is really great. I think you are going to serve a lot of people. I would recommend you read the book if you have time. I put it on the chat, and there are articles about it. It's few years old, but the subject is not old. It's always the same. It's always when you immigrate. It's the same thing. You are in a different place, different culture, different smell, different food, everything. So I really congratulate you. And Dr. Gelyani, it was also very educational for me what you said. It's beautiful, and I wish you continue this very important mission. Thank you.
Thank you very much. With your help. Thank you.
Thank you so much. That genuinely does mean a lot. And yes, this subject is so important, especially for our community, especially as we consider our children, the diaspora, the immigrant experience that so many Iranians are going through. And I fear that with the current crisis going on in Iran, we'll see a lot more immigration. And a lot of it will not necessarily be people who want to leave, but people who have to. And the children of those people, them themselves, they will have like these traumatic effects. And it's important that we stop these cycles and we try to help people resolve these feelings before we get there.
خب
I'm
از
here.
دوستان دیگه هم نظری دارم
Um,
سوالی اگه دارم اگر
Dr.
دوستان
Ahmadi.
دیگه بله بفرمایید
Salam Hameh. I really enjoyed this topic quite a bit. I have been hearing about this topic from quite a few other people, and I want to kind of piggyback off of Dr. Alavi's comments because I think what's really interesting is I was listening to her speak and also listening to y'all's presentation. The aspect of kind of maybe her perspective as an immigrant towards like her children, right? But somebody like me who was born here, whose parents immigrated. And I think we kind of see that in kind of a way that, like she said, we're kind of stuck between two worlds. And, here we're educated. Dr. Alavi was, um wonderful enough to go and continue that education into mental health. And I think also for myself is to kind of to see like what my parents and a lot of their friends kind of went through that they don't explain, that they can't explain as well, and the things that they've done sometimes in our names, but then I look back, I'm like, I think they did this for themselves. um but it was their mechanisms of how to cope and how to deal, and how not to lose some of that identity, like Dr. Alavi had also mentioned, where she finds that to be her mother country, and for our parents to impart that on us. Now, one other thing that I know, like I follow somebody on social media. I think her name is Michelle Malouf or Marouf. I know she's from an Arab Christian background, and she goes over quite a few of this transgenerational trauma, and then also provides a very interesting perspective in what they're calling this anti-colonialism psychology, and kind of looking at the roots of what we have in our own roots and systems. And that's what's something that I've been reading about a little bit, to see that, while yes, I completely agree, this intergenerational trauma absolutely exists, there's also mechanisms, and I think you guys touched on it briefly. I'm sorry, I was on the road a little bit, but I saw that you guys touched on it briefly, and I really enjoyed it. But how some of these ways we have to cope with this immigration overall, and from one generation of like my parents who've immigrated here in, my dad says the early 1970s, but I'm probably pegging him as an early 1960s person, to my parents who've immigrated here, to my mom who immigrated here at the revolution, the original revolution, in a sense. And then a lot of my friends who came, who are Iranian, who came around the Green Revolution time, and continued their education. And like Dr. Mirhashemi had just mentioned, we will hopefully see quite a bit of more immigration to this country. But we as healthcare professionals have to be prepared for that. So sorry for all of that I spoke about. I apologize. But my point was that there is some work being done to find some of the solutions through things that we're already as a culture familiar with, that allow healing as a group instead of sometimes the individual that we have narrowed down in this society and within our field. And I think looking into those helps a lot of our patients who need that help, and be able to maneuver some of those things, of what can help them. And I think, again, Dr. Alavi mentioned, I think she's part of some kind of group that was going for 30, 40 years. So thank you again, Dr. Alavi. Thank you, Dr. Mir Hashemi and Dr. Gelyana. So
You're
thank you.
very welcome. Thank you for your comments, Yunus. My question of people who, like, as Dr. Ahmadi said, being children of immigrants, any of you want to share, like, or younger people that have been immigrated here to a new culture, any of you want to share, like, anything that was for you, like, as a stress or as a trauma, or as something that was non-routine?
دکتر مرکل رفتن.
How many of us are there?
اوکی.
16.
دکتر مرکل هم دستشون رو بلند کرده بودن ولی رفتن.
Maybe she will
نه.
come back.
هستم. گفتین که یک چیزی
هستید؟
اگر
آره
میشه
بفرمایید.
Hi everybody.
Hi everybody.
من
Hi
خودم
everybody.
10 سالم بود.
ببخشید.
ببخشید.
بفرما.
10 سالم بود که امیگریت کردم. خب دو جور اثر رو من گذاشت. یکی کالچر کاملا متفاوت. ایران سیستم درسیش خیلی استریکتره تا اینجا. اونش که به کنار که من هر دقیقه حتی مثلا بلد نبودم درست بگم pardon me، نمیفهمیدم یک چیزی رو، هر دقیقه دم میز معلمم بودم میگفتم what، چون نمیفهمیدم، چون باید این که فکر کنین از شاگرد اول یهو بخواین بیفتین آخر سر کلاستون، چون هیچی رو بلد نیستین. 1 سال طول کشید تا بتونم انگلیسی رو درست یاد بگیرم. و اصلا مادر پدر من به مدرسه احضار می شدن به خاطر اینی که من نمیفهمیدم، نه به خاطر اینی که دانشجو بدی بودم. حالا اینش به کنار، ولی سر همین اینی که انگلیسیم خوب نبود، یه دونه earthquake drill داشتیم ما و من لغت earthquake رو میدونستم، کلمه drill رو نمیدونستم. من بچه 10 ساله زیر میزم داشتم میلرزیدم، وای الان مثلا قرار زلزله بیاد، مامان بابام کجان، داشتم مثلا دعا میکردم واسه جونم که باید چی کار بکنم. و یک اتفاقی که از این قضیه افتاد، من الان که برمیگردم تو کامیونیتی هنوز معلم کلاس 5م رو میبینم و این براش یه درس شد که ببینه که بچه های ایمیگرانت کلاسش همه چی رو تا اونجایی که میتونه بهشون بفهمونه. و دلیلی که این رو شیر کردم به خاطر این بود که ما به عنوان تراپیست خیلی خوبه یا سایکایتریست که این اکسپریانس های خودمون لیفد اکسپریانس میتونه به بقیه کمک بکنه. ولی من همیشه یه نظری که دارم اینه که mental health community فقط اونایی که رفتن سایکولوژیست یا سایکایتریست شدن نیستن. هر کاری که میکنیم باید معلما رو هم در نظر داشته باشیم برای ترینینگ، چون اونا جزء mental health تیم ما هستن. بیشترین کانتکت رو با جنریشن های بعدی معلم ها دارن. برای همین این اکسپریانس رو شیر کردم که این اون گریه اون موقع که هیچ وقت یادم نمیره، ولی معلمم هم انگار یادش نمیره و این برای اون یه دونه تیچینگ پوینت شدش.
بسیار
ما
عالی.
دکتر ممنون دکتر نینو رو داریم، دکتر معتمد، دکتر علوی دستشون رو بلند کردن. به هر کدوم
فکر کنم بعد دکتر ادمز بودن که دکتر نینوس ادمز.
بله دکتر ادمز. بله
مرسی خیلی ممنون. ویدیو روشن کنم. ببخشید من پسرم 4 ساله اینجاست، هرگز صدا بکنه ببخشید. منم اگه مثلا پرسیدی اگه کسی که اینجا به دنیا آمده به پرنت ایمیگرنت، من اونجوریم. من اینجا به دنیا آمدم به خاطر همون. من فارسی هم خوب نیست، من آسوری هم، ولی از ایران اومدن. چیزی که من میتونم بگم که از پرنت که تراما داشتن با شاید از یه کشور دیگه اومدن با همون immigration trauma or any other type of trauma that they have with them, generational trauma as well. چون که ما اصولی میدونیم که genocide خودمون هم داشتیم 1915 World War I. حتی ماما بزرگم تو همون بود که برادرش فوت کرد تو اون. ماما بزرگم من با پدر بزرگم اونا بچه بودن، پیاده رفتن از ایران به روسیه و برگشتن just in time for World War II، برگشتن به رضایی. Anyways, one thing that I can say is oversharing by parents who don't know any better can be traumatic to the child. I think that's one thing where education can be really, really helpful. But, excuse me, undersharing can also be very hurtful or very not helpful at all. So I think those parts are really big. And then maybe perspective. And I'm a huge proponent of group therapies, but perspective to our patients who are victims of transgenerational trauma or first-degree trauma. Perspective in that, you know, we are humans. To be human is to have suffered some type of trauma. It's only us in today's world. I try to talk about this with my colleagues and with some of my patients when I get a chance. But out of the history of mankind, of humanity, we are living the most comfortable of the rest of humanity behind us. And I'm not saying that it's perfect, but we are living very comfortably compared to those that came before us. And especially if we are in this country, we're living super comfortably compared to other people in other countries. And I think perspective can be helpful, and helping to teach resilience can also be very, very helpful. Resilience is, I think, an underplayed factor here. and talking it up can be helpful. So perspectives from a first generation person who can say that they've lived through some of this.
Thank you very much for sharing it and pinpointing to that oversharing or undersharing of kids with immigrant parents, so cultural crash. Yeah.
دکتر معتمد شما بفرمایید. خانم دکتر علوی.
You know, actually, I was hearing my own echo. So for sure, I did not immigrate here as a kid, but if we have to be, honest and frank, even as an adult, we all been, traumatized, and then we experienced that, and just unfortunately, even again, you can see within the at least last maybe 8 or 10 years. So there is this movement even in this country that we could just tell all immigrants been discriminated against. So, and as a child psychiatrist, also I need to mention that that was very, insightful presentation, and thank you. So, as you mentioned, the effect of trauma on kids of immigrant people. So, also we know that it has to do with the number of traumas. So we call like adverse, childhood events, and the more we have of this adverse childhood events, will be the higher risk of developing psychiatric, disorders in kids. And again, unfortunately, when the people immigrate to this country, we talk about like people from our country, from Iran. So it's just like a lot of people come unprepared. So, I mean, we've been lucky, as I said, even we came here as a doctor and we still, like, until we got into residency. So there's all been a trauma. Even to this date, we've been lucky enough, I mean, with the hard work and luck and everything else. So we basically been able to get to the point that we are right now. But even on a daily basis, we cannot just say that, oh, we've been just, really treated 100% equally like, American people. No. I do remember I was practicing, and then in Connecticut. So I had a patient who was a kid of Iranian immigrant who born in this country, and she was like a 13 years old. So like typical Iranian, look. As a matter of fact, very pretty girl. So, but just because of typical, Iranian look, so the people, because she was going to a school that they were all white, like maybe 90% white. So they were calling her Osama bin Laden. Just imagine, she's a girl, they were calling her Osama bin Laden. So when we talk about the number, adverse child events, so imagine the parents came, both were educated in Iran, but they came here. Actually, the father was engineering in Iran, the mom was a teacher. But here, they were working in other capacities, like a regular, other, kind of, jobs, because they could not do whatever they were doing in their country. And then another thing is, and these are really all we just see around ourselves. So to the extent, I know one famous, therapist, I don't want to mention the name, and people know that. Actually, I think in a way he's right. He said that sometimes, when the people come with this, they say, oh, they've been lucky to get green cards, through this different programs like diversity, like a visa program. So he's calling it like actually unluck, because these people come here unprepared. The parents at the age that they cannot, most of them, continue their education. They cannot provide even the basic things that they were able to do it in Iran. They cannot do it in here. So the kids not going to go to school. they don't have that much of income. So all these trauma. So, and then that's what we see, you know, like we see the kids and teenagers of immigrant people, unfortunately, they are at higher risk of developing at least anxiety, depression, more than people who born here, or at least parents had a chance to provide them with more, resources. So I think one of the goal of SIPNA actually will be, or supposed to be, if we can, to target this population and trying to, help them out. As again, in your presentation was how important it is that, to get this, population and try to help them early enough. Thank you.
Thank you very much. I see.
بله بفرم خانم علوی، اگه دوباره میخوان نکته رو بگم بعد مقال احتمالاً.
خانم دکتر حمیدی نکته خیلی مهمی رو گفتن که من میخوام روش یکم تاکید کنم و اون مسئله cultural competency. ما در گروهمون این کورس رو درس میدادیم، نه فقط به منتال هلت پرووایدرها، بلکه من خودم کورس های منیجمنت که درس میدادم به کسانی هم که میخوان منیجمنت بشن این درس رو میدادیم و بعد همونجوری که فرمودن معلمان باید یاد بگیرن و کسانی که با به طور کلی ایمیگرنت ها کار میکنن، به خصوص الان که تو آمریکا واقعا مالتی کالچرالن، خیلی هم ایمیگرنت زیاد هست و اینی که چجوری با یک ایمیگرنت صحبت بکنن، حتی به عنوان یک تراپیست، که شما دقت کنید که چجوری با یک مثل کلاینت صحبت بکنید که اونا رو you don't offend them, you don't make them feel bad about their culture. You have to be very careful how to deal with it. So the cultural competency, regardless of who you are, a teacher, etc., is good. I recommend to our younger generation here that there is a book called Funny Farsi. I don't know if you have read it or not. It's written by Firuze Domas, who is my relative. And she writes a book about when years ago, when their parents came, I guess, in Texas, how funny it was the way her parents would behave. You know, Maz Jobrani talks about it, and how she felt about it, that her mother would go to school and say things that it would either embarrass her or it would funny or whatever, you know. So it's very important to have that kind of knowledge and understanding about different cultures. And also, Miss Mirhashemi, there is a woman called Marjan Alavi in your university. She's a professor at electrical engineering department. If you ever need anything, you just go to her. I'm sure you don't need any help, but she will be there. You know, she's nice and she will be a good friend to you. Thank you.
Thank you so much.
مکل، شما میخواستید دوباره بگید would you like to say something or you haven't raised the hand؟ اگر نه که بریم سراغ آریان دکتر علی آبادی. بفرمایید دکتر علی آبادی.
سلام مجدد خدمت همه. خب من فکر کنم توی گروه از همه تازه‌وارتر باشم توی آمریکا و حالا تجربه من از کل پروسه تروما اینجوری بود که یعنی من مثلا خودم که بهش فکر میکنم که من اگه یه روز بخوام پرنت بشم و چه تجربیاتی و چجوری این پرنتینگ رو باید انجام بدم، اینه که خب این وقتی بهش فکر میکنم میبینم که من خودم اومدم با یه سری بگیج اومدم، یه سری ایموشنال بگیج، یه سری تروما داشتم، وارد آمریکا شدم و خود پروسه مهاجرت یه سری بگیج دیگه تازه به من اضافه کرد. انگاری من اون بگیج قبلی رو فقط یه جا توی گاراژ گذاشتم و الان دارم با یه سری بگیج جدید دست و پنجه نرم میکنم و میدونم که تازه من قدم به قدم هر سال دوباره هر مرحله رو که میرم جلو، خب یه سری چیزا از تو این چمدون در میاد، یه سری چیزای دیگه بهش اضافه میشه. ولی ایونچوالی این چیزایی که میفهمم که حالا هر کدوممون تو هر پروسه‌ای و توی هر مقطعی که داریم زندگی میکنیم باید باش دیل کنیم یه جورایی. و خیلی ممنونم از پرزنتیشنتون، واقعا عالی بود و امیدوارم که بتونیم حالا به هم دیگه کمک کنیم. راجع به ریسرچتون هم من خیلی خوشحال میشم بتونم کمک کنم. مرسی اصلا.
درود بر شما. اگه بله
دکتر اسکندری
بفرمایید.
فقط اجازه بدید من فقط یه نکته میخوام به آریان عزیز دکتر علی آبادی بگم.
بله.
There was a big difference in whatever you said. Insight. اینسایت خیلی کمک میکنه به آدم در زندگی. شما گفتین یه بگیج دارین تو گاراژ، یکی دیگه هم اضافه شده و همین دونستن این که یک چیزی داریم که کی هست که نداشته باشه، این خیلی کمک میکنه برای رفعش در آینده. which is very important. برای شما آرزوی موفقیت میکنیم. در ضمن سیپنا برای شما هم هست. هر چیزی خواستید بگید. این پرزنتیشنی چیزی اینجا براتون آماده است.
ممنون از شما.
اگه اجازه بدید درود بر سرکار کاربخش عزیز. حال شما بفرمایید.
درود
Long time no
به
see.
همگی.
خوشحالم در
بله، با
خدمتتون هستم.
پوزش مسائل جنبی جهانی همه رو در بر گرفته. من سپاسگزارم از خانم دکتر میرهاشمی و دکتر گیلیانا برای پرزنتیشن فوق‌العاده مهم و خیلی خوب کاندنسش کرده بودن که توی این زمان کوتاه بتونن اینو ارائه بدن و همه ما دستی دور بر آتش نداریم. همه ماها مهاجرت کردیم، ولی من فقط میخوام اینجا اینو شیر کنم که با آگاهی و اینسایتی که به شرایط کنونی جهان هستیم ما همه داریم و چشممون رو نمیتونیم روش ببندیم، ما هر روز تراماتایز میشیم. It's a mass trauma. It's a global trauma and it's خیلی this is really detrimental to know it as mental health practitioner that it's constantly changing. Before, if it was a war, it was taking time. Somebody go get the news and come back. People would not see the atrocity and brutality and all this stuff. But everything today is in our phone, is in our kitchen, wherever we are. The stuff that they are totally out of the norm of life of human being. The stuff, it's not political here at all, but it's talking about our humanity and stand for love, unity, awareness as a whole cosmos or universal stuff. Even though the more we are going to quote unquote civilization and technology and AI and everything else that everybody knows, there is the separation from that self, our true essence, which is actually the first trauma of anybody's life, is that separation from the true self. And that's when we are born as pure consciousness into the body and form, and we get it that this is who I am. I'm Roya, I'm this, I'm that, and all this stuff. And that trauma comes with us throughout the life, with the traumas that Dr. Mirhashemi talked and you guys from the epigenetic and everything else. The most important thing is now that the science is showing that all of the mitochondria that the men and the women get is coming from the mother. And the fascination of how the mitochondrial DNA is different with the other one, and how much of the effect of trauma happens or anything in life first into the mitochondria. The support of the women that they have been in any culture, going through much more. And that's something because of the way that the life has created the woman for creation and compassion and taking care of and giving and all those stuff. And also the society and the environment and the trauma would be, and the war has been always victimized more children and women. We know that. And all of our, whatever we inherit goes to our mothers, grandmothers, and grandmothers. So that's the maternal lineage that we have. So how important it is to be conscientious of providing support, love, understanding inside group or anything else for women, immigrant or non-immigrant. And we are dealing with the multicultural stuff. Yeah, sometimes I had clients that they had to leave. And how difficult it is. Young generation, they are here and not from Iran. I mean, from other countries with these issues, and then the separation, and then all this stuff that everybody's going. The most important thing goes back to truly be who we are as human beings first, in unity and love and understanding of our client, then as their mental health, and working, especially you guys that you are the generation, maybe 2 generations after me that you come, for the importance of community and connection with each other, and get the community involved. That's very important. That's something. And the trauma, as one of the doctors said, the resilience. We have such an amazing inherited culture that is fascinating. And in that, I mean, you have the teaching of Ferdowsi, you have Hafiz, you have Attar, you have Maulana. In that, our Osture, our myths, have those tools much more providing, I cannot compare them, but can be used along CBT, ACT, or other sort of therapy, and getting back to the root. Yeah, as Dr. Alavi said, we always have our longing for the mother, for where we were born, for the smell of, even the food and everything else. And there's a poem which says, I think it's from one of the contemporary poets, which says, کاش آدمی میتونست وطنشو مثل بنفشه ها با خودش ببره. And how much important it is, we all, as one of the doctors again said, know our humanity, that we are not perfect, we are vulnerable. Be open to that. Admit what is happening and use all the resources that we have as human beings, especially this group with the amazing rich culture background that we have, and be here for each other. And I should thank SIPNA. I mean, when I came here, that was a different era, like the APA, everything was more psychoanalytic and everything else. And the pioneer, that a few of them are still here, they had these meetings. And when I was resident first year or second year in New York, I was just fascinated seeing my own country's people are great provider here, and they are role models. And hopefully you guys are going to be or me too, all of us are going to be for the next generation, that they are even born later than you guys, or coming with lots of trauma-related issues from the past. I'm truly fascinated with the work of SIPNA, with all the stuff that it has gone through. And I actually own this gratitude, like I give it to them, because they deserve much more, whatever they have done back home when they came, whatever they have done here, and still they are keeping the space for people that they are interested. There are so many stuff are happening, and people have choice or kind of free will, what path to choose. But I think people that they are here are choosing the path of our ancestors with that beautiful, rich culture, standing for humanity as بنی آدم اعضای یکدیگرند که در آفرینش ز یک گوهرند، چه عضوی به درد آورد روزگار دیگر عضوها را نماند. و prayer for world and global peace, insight, love in unity, and nothing would be changed unless each of us be whatever Rumi says تو مگو ز صلح من چه آید که همه به جنگند تو یکی نی هزاری تو چراغ خود بیفروز. سپاس فراوان از شما همتون.
درود بر شما خانم دکتر، ممنون که همیشه شما به محفل ما مطالبی رو اضافه میکنید که واقعا الهام بخشه. بشنو از نی چون حکایت میکند، از جدایی ها شکایت میکند. مفهوم اکزیستنشیالیزم، مفاهیمی که در مولانا در مکتبش هست، بسیار الهام بخش. برای همین بحث هم همینطوره. من 2 نکته رو بگم. ما نکته اول اینه که سعی بکنیم که 5-6 دقیقه، حتی اکثر 10 دقیقه بحث رو رپاق بکنیم، ولی 1 دقیقه وقت رو من بگیرم. خانم دکتر، یک کلاینتی داشتم که مادرشون برای ایران رفته بود 1 هفته وسایلش رو بفروشه، طلاهاش رو بیاد اینجا دیگه، و خب اونجا بغل یکی از خانه های امنشون از بین رفته بود و متاسفانه و خانواده عزادار شده بود. یه 3 جلسه ای رو ما با هم، ایشون چون صوفی بودن اینجا، با مولانا رفتیم جلو و گفتم این مکتبی که شما دارید چقدر الهام بخش میتونه باشه، کمک بکنه به شما در کنار CBT که از این ترومایی که دیدی بتونی خلاصی پیدا بکنی. خب جناب دکتر گلیانا، بقیه دوستان ما هستیم خدمتتون. جناب دکتر گلیانا شما فرمان از شماست.
اول از همه از خانم دکتر کاربخش خیلی ممنون. مثل همیشه ما خیلی استفاده بردیم از معلومات شما و از جهانبینی شما. خیلی ممنون. و شما گفتین سیپنا همه ما، سیپنا مال همه ما، رو هم سیپناییم. سیپنا یه انتیتی جدا از هیچ کس نیست. برای همه دوست داریم که هر کاری که لازم باشه اینجا انجام بدیم و همه ما اگه کاری باشه در خدمت جامعهمون، افرادمون و جوانانمون باشیم. به هر حال خیلی ممنون بازم از لطفتون. my own دکتر سیمونیان که اگه هنوز اینجا هستن، خواستم اینم آقای دکتر سیمونیان از ارگونومی آیا در مورد ترانسجنریشنال تراما چیزی داره، نظری در اون مورد داره یا نگاه میکنه به اون؟ یا
عرض کنم که اولا خیلی ممنون، پرزنتیشن خیلی خوب بود، خیلی اینفورماتیو بود. البته خب تروما است، ولی این بعضی تروماها خیلی عمیقن و این پرزنتیشن هم که کردید خیلی خوب بود. البته اون سکشنی که برای هیلینگه به نظر من یه خورده خوشبینانه ابراز شده بود. اینقدر هم آسون نیست اون تروماها رو در آوردن. من مریض داشتم که مادرش از جنوساید ارمنی ها بود و اون خودش مثلا از 70 سالش بود، هنوز از اون حرفایی که مادرش میزد به من میزد، که مثلا مادرش میگفت که چرا پدرش رو وقتی خودش 5 ساله بود پدرش رو جلو چشمش کشتن و این هنوز اون چیز رو داشت، میگفت که چرا پدرم رو کشتید و این روی این خانم خیلی تاثیر گذاشته بود. اصلا مادرش به خاطر همین تروما بسیار محدود بود از نظر ایموشنال، که به اینا لاف بده، به اینا بتونه با محبت و با اون افکشنی که باید لازم باشه با این بچه ها باشه و این خیلی اینها رو هم تاثیر کرده بود و خب دیپرشن داشتن و اینا. پس سعی می‌فرمایید این جنریشن ترانسجنریشن تروما به این صورت به جنریشن های دیگه هم تاثیر میکنه و البته تاثیرش عمیق. هیلینگ آسون نیست، البته خیلی باید کار کرد روشون و من گاهی فکر میکنم که یه احمقی یه سنگی رو به زبان فارسی خودمون میندازه توی چاه، 100 تا عاقل نمیتونن اون رو در بیارن و این چیزایی که امروز ما تو دنیا میبینیم، همونطور که خانم کاربخش فرمودن. و این تروماها درسته که ما we have come a long way، ولی هنوز همون جنوسایدا که 1915 و قبل از اون جنوسایدهایی که در ایران شده همینجوری ادامه پیدا میکنه در جاهای مختلف و این هست و اینو خوبه که شما این پرزنتیشن رو میکنین، این آگاهی رو میارین که یک جنگ، یک جنوساید فقط به اون نسل تاثیر نمیذاره، اون جنایتیه که به نسل بعدی هم تاثیر میذاره و این خیلی خوب بود و خیلی ممنون از پرزنتیشن شما.
خیلی ممنون. پس اگر دکتر اسکندری گفتن یه چند دقیقه است فقط، اگر خانم محگل اگر اینجا هستی، اگر چیزی میخوای در مورد راهپیمایی سویساید بگی یا میخوای بعداً اینا رو بگی چیز کنی؟
هرچی شما صلاح بدونین. الان توی این جمع فکر میکنم چندین نفر هستن که در مورد این اینیشیتیو نمیدونن. اگر اجازه بدین یه کوچولو فقط توضیح بدم که اگر خودشون بخوان اینوالو باشن یا کسی رو میشناسن، چون الان توی قسمت های اولیه هستیم که یه کامیتی درست کنیم ببینیم کی میخواد کمک بکنه. اگر که شما صلاح بدونین یه کمی توضیح بدین.
بله بفرمایید.
این اینیشیتیوی که ما داریم راه میندازیم الان فعلا این ورکینگ نیمشه، شاید تغییر بکنه، Healthcare Alliance for Suicide Prevention هستش که دلیلش اینه که یه کمی سویچ میکنم انگلیسی، شاید راحت تر بتونم توضیح بدم اگر اجازه بدین. Throughout our careers, we've all seen the impact of physician and healthcare worker burnout, mental health challenges, and unfortunately suicide. This has been something that I've deeply been committed to and part of what drew me through psychiatry. And rather than asking what more can I do individually, I started asking what can we accomplish together as a community. I've personally been involved locally with the American Foundation for Suicide Prevention, volunteering and participating in their initiatives. Particularly, they have an Out of Darkness walk. I've participated with them as a team leader and also sitting on the Los Angeles planning committee for the walk. And just based on that experience, I saw an opportunity for a more extensive involvement that could connect our Iranian healthcare community with a larger national effort. And I met with the American Foundation for Suicide Prevention staff to discuss creating a national team that is composed of local teams across the country. And they confirmed that this is possible. And previously, there has been healthcare organizations that do this, but on a more local level, not so much on a national level. So it would kind of be a first big initiative from the healthcare community. Speaking about the vision, the walk is really just a starting point. It's more of a broader vision to bring together Iranian healthcare organizations as founding collaborators to build together a sustainable initiative with AFSP, focusing on things like healthcare worker, mental health, suicide awareness and prevention, education for the healthcare community and beyond, advocacy, fundraising, and any means of community support. And while that I hope that the Iranian healthcare community helps lead this effort as the founding organizers with SIPNA starting this initiative and welcoming other Iranian healthcare worker associations and organizations as collaborators, the initiative itself is intended to be open to all healthcare professionals of all backgrounds from the very beginning. Right now, our priorities are focused on building the founding team that works on this together. So we're in the process of identifying organizations, local team leaders, collaborators, and resources that could help with this initiative. So if anyone wants to be involved or has any ideas that could help with this initiative, I would really appreciate maybe either sharing via email or right now in a moment. We're also developing educational materials for this initiative and planning the next steps for outreach. I have built a planning document and looking for team leaders across the nation that can help with the planning process. If there's any particular area you'd like to help with, whether it's outreach, education, we've even talked about potentially doing a research survey about suicide among the Iranian healthcare workers in North America. Other things would be design, because we're going to need some design efforts for the project. Any experience or help with fundraising or organizing a local team where you are. So right now this is still in its early stages, which means everyone has the opportunity to help shape it. The walks usually take place between around October. So we still have some time to get the pages live. I'm hoping for at least 2 months of outreach and awareness before the walks. I'm excited to see what we can build together, and I'd love to talk with anyone who's interested after the meeting. Thank you for giving me the time to share.
Thank you very
Dr.
much.
McCall, may I share your email here? The others may would, be connected with you, because of
Yeah.
course
Of
we will,
course.
we will announce the project, and Ms. Hashemi also can have a minute to discuss, to explain more about that. Yeah, Dr. Gelyana, بفرمایید.
Great idea. Just I want to say again, we see that the young people, when they join us, they have great ideas and we support them. So, and we know that physician resident suicide, unfortunately, in our country is one of the countries that has in a higher rate of physician and resident suicide. So in this walk of suicide, we will support their cause as SIPNA, and we will ask other Iranian health professionals. And if any of you have any idea, just tell Makbul. Maybe we all can put it together and support their cause. And kudos to you. Thank you.
Thank you so much for the opportunity to be here today. Genuinely, it has been such a pleasure and a privilege to be working with SIPNA, and this has been a topic that has been so near and dear to my heart. You guys asked if anybody here is like the child of immigrants. I consider myself the 1.5 generation, half raised here, half raised there. And I've experienced critical developments in both countries and experienced immigration, the traumas of my families, and everybody has. Like, as we've discussed, it's very predominant, it's very common to experience transgenerational trauma. And healing is not easy. Healing is most certainly not easy, but it is possible. And we are continuously figuring out how. And doing research on this topic, especially research for people of cultural minorities, is so essential. And that is what we're hoping to achieve here. As Dr. Iskandari mentioned in the beginning, as Dr. Gelyana mentioned in the beginning, I'm planning to start a research project on Iranian mental health. Now, my focus for this particular project is transnational trauma and the trauma that people may have experienced, or the mental health effects that people may have experienced within the past year with regards to what has been happening in Iran. Regardless of the fact that I am the 1.5 generation, I still feel Iran very deeply in my heart. It's not something that goes away. It's, for a lot of us, sacred still. And as we've discussed, you miss, حتی خاک ایران, you miss it. You miss the sounds, the people. And it's important to try to make sure that we help them as much as we can, both here and abroad. And culturally appropriate mental health care is so essential when it comes to this. It was wonderful to hear all different perspectives of bringing Molana or different cultural aspects to therapy and how we can help individuals. I personally learned a lot. I will be looking into the books that Dr. Alavi suggested. And yeah, thank you so much for the opportunity.
جان دکتر گلیانا، حسن ختام از دعوت ادامه دیگه با شما.
بازم یک بار دیگه از همتون خیلی ممنون که وقت گذاشتید. این یک شنبه بعد از ظهرتون رو با ما بودید. 2 مرتبه خواهش میکنیم که این زحمت رو 2 ماه دیگه هم بکشید برای 2 سخنران آیندهمون که در ماه سپتامبر در مورد ادیکشن صحبت خواهند کرد و اطلاعات و زوم و اینا زودتر خواهید گرفت. تاریخش رو دقیقاً میدونید خانم میرهاشمی که سپتامبر 20th, yeah? سپتامبر 20 خواهد بود و دو مرتبه در همین ساعت‌ها و این صحبت‌ها رو خواهیم کرد و این بیتوین دیگه هممون دیگه هر مطلبی بود یا به من یا به دکتر معتمد یا به دکتر اسکندری بگید و یا به خانم میرهاشمی و سعی میکنیم که مسئله رو به مسئله رسیدگی کنیم. برای خیلی ممنون و شب خوش و روزهای خوشی داشته باشید.
سپاس فراوان از همه. به امید موفقیت.
درود بر همگی.
درود.
خدا
درود بر شما.